Hi everyone, it's Dr. Ramani. Welcome back to this YouTube channel on all things related to narcissism and understanding these difficult personalities. Today we're going to be taking on an issue that's very specific to people who are surviving narcissistic abuse. And specifically, we're going to take on the issue of how people who are survivors of narcissistic abuse are often the ones that are pathologized. And what I want to do is almost take this as a riff from what many people have often said is a big issue that got raised in domestic violence circles and domestic abuse circles. Because what the mistake that's often made is that when we look at a domestically abusive relationship, for example, so much focus is put on, for example, why did the survivor stay? And so much less focus is put on why did somebody abuse someone else? Well, building on that, when we look at narcissistic abuse, what we see is far too often when a person with narcissistic abuse shows up at therapy, they're the ones who are pathologized. The survivor is pathologized. Their symptoms are focused on rather than viewing it in the larger context of the relationship. So let's take on this issue of how survivors of narcissistic abuse get pathologized. So when we lay out the patterns that are observed in people who are experiencing narcissistic abuse, confusion, self-doubt, anxiety, apathy, helplessness, hopelessness, powerlessness, rumination, anger, sadness, all kinds of physical symptoms, it's not actually surprising that survivors are often diagnosed with, treated for, and believed to be experiencing a whole range of psychiatric issues, including anxiety disorders, mood disorders, adjustment disorders, post-traumatic stress disorders, and even personality disorders. Now, in some cases, in more than a few cases, these assessments are true of the individuals experiencing these symptoms and who also have to be going through narcissistic abuse. But here's the rub. It's not always true. And in the absence of a thorough analysis of the precipitants or the things that set off the symptoms in a person's life, especially a precipitant or a trigger like a toxic relationship, we may be spending too much time pathologizing the survivor and not the situation. And in many cases, both things are happening. A person may be experiencing an anxiety disorder, but may be experiencing more pronounced symptoms because of the narcissistic abuse. In the macro, in the bigger worldview, there's a risk to focusing solely on the survivor's current patterns and behaviors. It's something, though, that often happens in mental health. You work with the patient in the room. That's all you got. You have the person in front of you. You hear them talk about their symptoms and patterns. You throw them into the hopper, and often out pops a nice DSM diagnosis. But in the toxic relational realm, like narcissistic relationships, it's not quite that simple. Because when we focus all of the attention on diagnosing the survivor, we are perpetuating a cycle that the survivor is already stuck in. And that cycle is self-blame, self-pathologization, a playing out of gaslighting narratives by other people. What's wrong with you? There must be something wrong with you. You must be crazy. Your anxiety is making you forget things. These are the scripts that are playing through someone's head who survive these relationships. The survivors are more likely to come into therapy than the narcissists or other antagonistic people who tend to have very little self-reflective capacity and are unable to engage in the work of therapy. Thus, the survivors of narcissistic abuse often bear the burden of being diagnosed much more often than those who are actually generating the harm, because those folks rarely go into therapy. I have been told or heard countless stories of people being told that if they could just get their symptoms under control, so survivors could just get their symptoms under control, if they weren't so needy or didn't need so much reassurance or had a little more energy, then maybe their partner or whomever it is in their life that they're having a difficult narcissistic relationship with, the relationship would work a little better. One case in particular, I had been a long time ago told about. A therapist said, well, Now that we have you diagnosed with an anxiety disorder, we can get you treated, and I'm sure your partner's going to notice the difference and things will get better. The woman, the patient, who had the so-called anxiety disorder, was in a horrifically difficult relationship with a malignant narcissistic person. And this woman walked on eggshells. Even in her sleep, she was afraid of making noise. And sadly, was so confused by the relationship that her diagnosis of an anxiety disorder meant that she had hope. She could put the blame on herself, and she had hope that once she had her anxiety in check, then things would get better. She did the hard work on her anxiety, took medications, went through therapy. Things didn't get better in the relationship. Why? Because her partner was a narcissist. And her symptoms actually continued to get worse because nothing was shifting in the relationship, no matter how much work she did. Another issue around focusing on the pathology of the survivor is the common error of making assumptions about the problematic communication skills of the survivor in a narcissistic relationship. Because after all, if they were communicating properly, then these things shouldn't be happening. Many, many, many survivors of narcissistic abuse have been harmed in couples therapy, family therapy, even in workplace mediation by people who do not understand these dynamics and will focus on the, if you will, communication errors of the person who experienced the antagonistic and narcissistic relationship rather than reflecting on the idea that perhaps the narcissistic person has never listened, never offered empathy, and probably never will. This is the reason that it is so important for all clinicians to understand the fallout of what happens to a person who is or has been in a narcissistic relationship. A central pillar of treatment for narcissistic abuse is psychoeducation. Yes, I know the familiar refrain and will make it here. I know this very clearly. We cannot diagnose someone that we have not met. This isn't about diagnosing or labeling the spouse or the partner or the parent or the friend or the sibling or the boss. This is about focusing on the patterns the client experienced. Calling out gaslighting as gaslighting. Calling out invalidation as invalidation, contempt as contempt, verbal abuse as verbal abuse. And no, this is all not just a big misunderstanding or someone having a bad day or I'm sure they didn't mean it. It's about calling out the patterns and to understand that these patterns, especially when they're consistent, are reflective of a rigid and antagonistic personality style that does not change. To let the client know that when someone manipulates them, it is not about the client, it's about the manipulator. There is a real danger to focusing on pathologizing the survivor rather than seeing that the systems and the abusers are the issue. The systems and the narcissistic abusers are rarely under the microscope, so they may not be subjected to the same level of clinical scrutiny. But the survivors are desperate for help, so they go into therapy. Now, when we do that, when we pathologize the survivors, we re-perpetrate these cycles for generations and augment the trauma and the harm. The balancing act here is very tricky. Many survivors of narcissistic abuse or people who are experiencing the wide range of fallout of antagonistic relationships are struggling with lots of clinically significant symptomatology: anxiety, depression, apathy, post-traumatic stress symptoms, confusion, self-doubt, self-blame, helplessness, hopelessness. And these kinds of patterns do require clinical attention. However, more attention must be paid to the context in which these symptoms occur. That when a client shares patterns within a relationship, such as gaslighting and invalidation and future faking and all the rest of it, to pay attention. And yeah, we have to address the anxiety and the expectable behaviors and thoughts and feelings that would be observed in someone, in anyone who is caught in a toxic relationship. But also to help a person who's caught in these situations to understand the triggers, the activations, and before just putting a tidy diagnostic label, oh, you're so anxious, on it, that implies that the person in the toxic relationship just dealing with the anxiety or sadness or hypervigilance and labeling that as a disorder, we absolutely have to ensure that they're educated about what is happening to them. It gives a very important context. When we understand post-traumatic stress disorder, we need to also understand the trauma. That model is also very similar in narcissistic abuse. We need to understand the relationship or the history of relationships that are narcissistic, and then help the client understand the relationship between their symptoms and the narcissistic abuse, while also monitoring all the other patterns they're going through. It's a lot, but it's a chicken egg issue. To address the clinical patterns like the anxiety a person's going through without addressing the toxic relationship means that you're ignoring the larger context, and it's also unlikely the treatment will work. When we pathologize someone, we do to some degree diminish their power and in some ways silence their voice. People who are pathologized tend to come at things in a more tentative manner and are less trusting of their voice. This is a pattern, as I said, we have observed in domestic violence survivors for a very long time. But when people come in for help because they're being abused, they don't expect to be diagnosed themselves, because that's what often happens. Whether the narcissistic abuse happens in the context of an intimate relationship, a familial relationship, or a workplace relationship, the knee-jerk reaction is to focus on the issues and the problems and the patterns of the person who's come in, and not the fact that the so-called issues that they've brought in are often normal reactions to an abnormal situation. It's missing the point to not identify that and continues to blame a survivor who has already been doing that, blaming themselves and pathologizing themselves for a very long time. Anyone who is seeing a mental health professional should not only have their current symptoms assessed, but also have a full mental health history taken, triggers explored, stressors examined, a look at relational issues, family history, medical history. They're all critical to assess in order to paint a larger picture. Too often in the world of mental health and in our zealousness and desire to figure it all out, or maybe even please an insurance company, we focus on diagnosing the individual rather than the context. And that's a mistake. So the key really becomes is that, yes, survivors are going through something, and the things that they're going through are really impairing their lives. That's absolutely the case. But when we attempt to put the full onus of it, try to understand what the client is going through and say, well, you have this disorder, rather than helping them understand the connection between their patterns and symptoms and the narcissistic relationship and the gaslighting and contempt and all those things and the effect that has on them, what we do is we sort of foster the client's sort of lack of understanding of the situation, and then we impede our growth. It's important that we educate survivors and definitely identify clinically significant patterns that require best practices and evidence-based treatment. But it's also critical that we shouldn't get so lost in attempting to diagnose and pathologize the survivors before we explain to them the impact of these relationships. Thanks again.